everyone. The Coordinating Center for the National Drug Early Warning System, sponsored by the National Institute on Drug Abuse, is pleased to welcome you to our second NDEWS Presents webinar for 2018. The NDEWS PI is Dr. Eric Wish, and our NIDA project scientist is Moira O'Brien. I believe that both of them are in the audience with us this afternoon. My name is Erin Artigiani, and I am the NDEWS co-investigator. Marwa Al-Nasir and I will be the facilitators for this webinar. We are part of the NDEWS Coordinating Center team based at CESAR at the University of Maryland in College Park. For those who are interested, you can find detailed information about NDEWS, recordings of our prior webinars, and invitations to future webinars on our website at www.ndews.org. You will also find instructions for how to join our NDEWS network and participate in ongoing discussions with more than 1,600 experts and concerned citizens from across the United States and many other countries. We are currently moving the NDEWS network to a new platform. If you have not yet joined our new platform, we certainly hope that you will do so you can continue to participate in our conversations and join discussions in groups including epidemiology, toxicology, and drug policy that are going on now. So you should receive an invitation from NDEWS, and you just need to click on that link and get your account set up, and you should be good to go. And you'll be able to start posting and reading posts from others at that point. We developed the NDEWS Presents webinars to work with leading substance abuse experts to explore emerging drugs and timely drug-related topics. This month, we're very excited to be joined once again by Jill Head, Supervisory Chemist at the United States Drug Enforcement Administration Special Testing and Research Laboratory. And as you may recall, Jill actually helped us launch the NDEWS Presents webinar series back in February of 2016 and has been one of our most popular presenters since then. We have been fortunate to have the opportunity to release the quarterly emerging threat reports produced by her lab through NDEWS, and today Ms. Head will be presenting an update on emerging synthetic drug threats in the United States. Her comments are based on the upcoming 2017 annual report, which is currently in process. It will be made available on the NDEWS website, www.ndews.org, along with all of the other 2016 and 2017 quarterly reports when it is released by the DEA. I will also post an announcement to the new NDEWS network to let everyone know when it is available. This webinar will be approximately 90 minutes long, and we encourage you to submit questions during and after the presentation. Please take advantage of the Q&A box and post your questions there. We will answer them as we go along, and Jill will hold a Q&A session after her presentation. We'll do our best to get to all of your questions, but if we miss a few, we will try to follow up after the webinar or post some additional information to the website. As in the past, a complete recording of this webinar, along with a copy of Ms. Head's slides, will be made available on the NDEWS website, which once again is www.ndews.org. So thank you again for joining us, and we really hope that you will enjoy the presentation. And I'm going to turn things over now to Ms. Head so she can get started with her comments.
Thank you, Erin. Can you hear me all right?
Yes, we can hear you.
Okay. Thank you, Erin, and thank you, Dr. Wish and Ms. O'Brien, and everyone over there at the NDEWS coordinating team. It's an honor to be asked to come back again. I really enjoy being able to share this information with the entire NDEWS community. And so what I wanted to do today for our update for 2018 is go through some of our updated data. As Erin mentioned, we haven't yet published our 2017 annual report, but the data that I'm going to be presenting today will be the first release of that information. And so we're going to get it here first, and we'll be sharing that and sending that to NDEWS to post in the next week or two. So the objectives for this afternoon are that I will be going through an overview of our laboratory and our programs here that are focused very heavily in monitoring and identifying emerging trends in synthetic drugs, and also in developing and preparing and making and providing reference materials, not only to our DEA laboratories, but also in the data that we create, making that available for scientists as well. I'll then go through the emerging threat report data for the calendar year of 2017. And one thing that I will also spend some time on is about seized drug composition. There's been many discussions about synthetic opioid drug overdoses and the analysis of toxicological samples and the indication of polydrug use. And in our conversations with the scientific advisory group for NDEWS and in the NDEWS listserv, it became clear to me that we could use some information about what drugs are looking like, not just number of drugs that are seized and identified, but also a picture of what those drug samples look like. And I think that information will prove to be very useful in that discussion. And then finally, I'll discuss some updates from 2017 on the SWIG drug monographs and instrument libraries that we have available. So the DEA laboratory system is made up of 8 big drug laboratories with about 500 staff. And one of those laboratories is ours, and we are DEA's research laboratory and also intelligence laboratory. So the majority of the drug analysis that we conduct here in our laboratory is for intelligence gathering purposes. The 7, what we call field laboratories, are responsible for identifying and quantitating seized drug samples that are submitted in the course of an investigation. So our program does analyze both domestic and foreign drug seizures. So in addition to being the DEA's research laboratory, our jurisdiction is also international. And so we analyze seized drug samples that are submitted through DEA's foreign offices for identification. We also research and develop methods for the identification and quantitation of all drugs, and in particular, new and emerging synthetic drugs. We also do what we call authentication of reference materials. And so this is a process by which we acquire a drug standard, and that standard goes through a chemistry process to prove that that drug is what it should be and establish the purity of that material. And reference materials are what forensic chemists use to make an identification in the course of their analysis. However, with the emergence of NPS and how quickly they emerge, there are not always reference materials available to make that identification. And so we do something called structural elucidation, which is a series of techniques that allow us to figure out how a structure is made up, how the carbons are attached to other carbons and how those are attached to nitrogens, and how the bonds are made up so that we can identify that drug without a reference material. We also publish all of our data through the Scientific Working Group for Seized Drug Analysis, and we post all of our data in the form of a drug monograph, which has the name, the structure, some physical characteristics like molecular weight and molecular formula, as well as instrumental data. And this is something that is posted on SWIG Drug's website. We also publish instrument libraries, which I'll talk about towards the end of my presentation. And a major part of what we do is monitoring past and current trends to help us predict what new drugs might be emerging in the future. And then, of course, we publish the emerging threat report. So the term new psychoactive substances is the name by which I'm probably going to be referring to those throughout the course of my presentation. In the United States, we also hear the term synthetic drugs. There is a difference between a synthetic drug and a new psychoactive substance. most new psychoactive substances are man-made, meaning they don't come from a plant. They're made by chemical reactions. However, another synthetic drug like methamphetamine or PCP is a synthetic drug, but it's not new and it's not emerging. And so we would not refer to that as an NPS. However, there are other NPS or new psychoactive substances that are not necessarily synthetic either, such as some plant-derived highs. So the categories that I have listed here are synthetic cannabinoids, cathinones, hallucinogens, synthetic opioids, benzodiazepines, and plant-derived highs. I'm primarily going to be discussing this afternoon the cannabinoids, cathinones, and opioids, although I'll touch on the other categories as well. Before I get into some of the data, I do want to sort of clarify what it is that we do here in the forensic chemistry laboratory. I noticed that a lot of the questions that I've been receiving after the NDEWS webinar has to do with activity in the body and toxicological analysis. What we analyze here in our laboratories are seized drug samples. So it's the powder, the actual cocaine or oxycodone tablet or heroin powder. These are the parent drugs. We do not analyze in our laboratories any biological samples or toxicological samples, and therefore we're not identifying metabolites. We are identifying the parent drug. And the identifications that a forensic chemist, their conclusion at the end of their analysis is entered into a laboratory information management system called LIMS, and all of that data is stored in that database. And our report, the emerging threat report, is compiled of data through a query of that archived seizure and analysis information from drug and evidence that's been analyzed by our laboratory system. And so this way of looking at data is meant to be a snapshot of what synthetic drugs are in the United States in a given time frame. And there are some considerations when discussing this data. One is the laboratory system backlog. Although the backlog is certainly on the decrease, there is still a backlog of evidence waiting to be analyzed. And so when we are trying to determine what drugs are new and emerging, it's important to be able to look at a data set that's recent. And so we take an approach looking at seized and analyzed drug data to limit the range from any drug evidence that was seized and analyzed within that calendar year. And again, it's not a totally comprehensive source of data, but it's intended to be a snapshot. Another consideration is availability of reference materials. And so as long as reference materials are available and identification can be made. However, there may be some that are in progress, or we're working on developing a reference material or working on making that available to our laboratory. And therefore, you might see terms like substance unconfirmed. And that's typically an indication that it's still in progress or awaiting available reference materials. We also exclude analysis performed here at the laboratory, at our laboratory, because many of the samples that we received are analyzed here again, meaning that there's a portion that's transferred from one of our other laboratories to ours to do research. And it also includes foreign submissions. And so we try to limit that to domestic seizures and identification. So starting with the synthetic cannabinoids, I have a table here of synthetic cannabinoids that have been seized and identified by DEA between January 1st, 2017 and December 31st, 2017. So in calendar year 2017, there were 922 synthetic cannabinoid identifications, which is actually a 6% decrease in the number of synthetic cannabinoids from the previous year. In 2016, there were 37 different synthetic cannabinoids identified. However, in 2017, there were only 21 different synthetic cannabinoids seized and identified, which is a 43% decrease. Although there's been a decrease in the number of synthetic cannabinoids identified and new substances, and total number of synthetic cannabinoids, we did analyze one new compound, which I have highlighted as 5-fluoro-EMB pinaca. FUB-AMB was the most reported synthetic cannabinoid, accounting for approximately 51% of the identifications during this reporting period. The synthetic cathinones seized and identified by DEA and analyzed between January 1st, 2017 and December 31st, 2017 is charted here. There were 369 cathinone identifications in calendar year 2017, which is an increase of about 5% over 2016. N-ethylpentylone was the most reported cathinone, accounting for approximately 54% of the identifications during the reporting period. And of the 19 substances identified, 3 were identified for the first time in 2017, and these are MMP, alpha-PPP, and 4-methyl-alpha-ethylaminopenteophenone. So there were 19 substances identified, which is actually about 20% decrease in the number of different synthetic cathinones that were identified in 2016. In 2016, there were 348 cathinone identifications, including 24 different substances. And dibutylone last year accounted for approximately 22% of the identifications. Instead of jumping right into synthetic opioid identifications, I want to provide some background information to provide some context in where we think that synthetic opioids are headed. And so what I have here is a list of the synthetic opioids that were seized in 2015. And valorolfentanyl, beta-hydroxythiophentanyl, butyrolfentanyl, acetylfentanyl, and fentanyl. For the purposes of including as much information as we can, we've also included 4-ANPP, which is not a synthetic opioid, but it is the precursor, the chemical precursor for manufacturing fentanyl. And so in 2015, there were only 5 synthetic opioids or fentanyl-related substances that were identified. And when we look at the structure of these substances, we see a pattern. And so what I have circled here in green is what we call a hydrocarbon chain. And so fentanyl is the second compound from the left, and this has what's called an ethyl group. It has 2 carbons in that chain. Acetylfentanyl has only 1. Butyrolfentanyl has 1 more than fentanyl, and valorolfentanyl has 1 more than butyrolfentanyl. And so what we have here is a difference in the structure based on the length of this chain, which is on the upper left-hand portion of the molecule. And this is important because of the way that fentanyl is synthesized, the way that it's made. And so in essence, this is a very simplified way to look at the synthesis of fentanyl. And I do want to point out this is a very simplified sort of explanation, but I think it is helpful in understanding where the modifications can be made to the molecule. So on the left-hand side is 4-ANPP, which is the immediate precursor, and that's reacted with an acid chloride, and in this case, it's propionyl chloride, which results in fentanyl. Now, the second chemical, the propionyl chloride, can be replaced with a different acid chloride. And so it's this second chemical that results in a change of the molecule in that region, creating acetylfentanyl, butyrylfentanyl, or valorylfentanyl. However, if we look at our chemical reaction here, and instead of just a chain, we can replace it with any number of acid chlorides or any number of chemicals that can react with the 4-ANPP in that position, resulting in some other type of functional group or other type of addition to the molecule to make something totally different. In this case, this is the reaction to a simplified reaction mechanism for making furanylfentanyl. And that's what we saw. That was the story of 2016. So this is a slide from last year that I showed, and these are synthetic opioids or fentanyl-like substances that were seized and identified in 2016. And in 2016, there were 15 different substances seized and identified, whereas there had only been 5 in 2015. And of those, 60% were seized and reported for the first time. And so there was really a tremendous increase in new and novel synthetic opioids that either had never been encountered or that had reemerged, as in, as with the case of 3-methylfentanyl and also carfentanil. However, if we look at, again, look at our synthetic opioid synthesis reaction, 4-ANPP can be made with, by reacting NPP with aniline. And this is what we would call a precursor. So it's a precursor to the precursor. And instead of modifying the 4-ANPP with a different reaction in that immediate step before the fentanyl, the NPP can be modified. And in this example, it's modified with a methyl group. And this creates a modified 4-ANPP precursor, which then would result in a 3-methylfentanyl. So the NPP was modified in a 3-methyl position, making a 3-methyl modified 4-ANPP, resulting in 3-methylfentanyl. And this is what we're continuing to see in 2017. You'll notice here there's a total of XX synthetic opioids identified in 2 years. That's something that we're going to put in our report, that we're looking at the total number of synthetic opioids that have been identified since the emergence of all the synthetic opioids in the last several years. But there's been a 117% increase in identifications in 2017, 18 different substances seen and identified, and an additional 7 new substances seized and identified for the first time. And I do have these listed here. Benzoyl benzylfentanyl had 1 identification, 2-thiophuranylfentanyl had 1 identification. We're seeing U47700 is a synthetic opioid, although it's not fentanyl related. However, we've identified, in addition to U47700, the 4900 and 48800, as well as tetrahydrofuranfentanyl, methoxyacetylfentanyl, and cyclopropylfentanyl. So switching gears a little bit, this is something that we took a look at in sort of a new way. And our laboratories they receive drug evidence based on a jurisdiction. So for example, drug evidence that's seized in Maine, New York, New Hampshire, that drug evidence would get submitted to our Northeastern laboratory. Likewise, drug evidence that's seized in the southeastern part of the country would get submitted to our Southeastern laboratory. And so instead of going through this exercise with all 8 laboratories, I picked a few to cover, because I didn't think going through it that it was that we were going to be able to look at it from a statistical approach. What we are doing here is looking at it as a snapshot, the way that we've been looking at other types of data. And I focused on the synthetic opioids because that's where we see the most cause for concern, and where we see some really interesting trends in drug mixtures. So in the Mid-Atlantic region of the United States, there were 17 synthetic opioid identifications. And I started with the Mid-Atlantic region because that's where we are, and so I was interested. So of those 17 synthetic opioid identifications, 15 of those were fentanyl. The other 2 were synthetic opioids. However, of those 15 fentanyl drug samples, only 6 of those contained only fentanyl. The other 9 were a combination of fentanyl and heroin. And then of those 9, 3 also contained tramadol, 1 also contained methamphetamine, and 1 also contained 4-fluoroisobutyryl and 2-furanyl-fentanyl. And so what we see here is the majority of fentanyl samples that were identified from this region were found that the drug itself was a mixture of fentanyl, heroin, and other components. What we see in general is approximately 49% or so of fentanyl samples are mixed with heroin. In the southeastern region of the United States, there were 12 synthetic opioid identifications. Of the 12, 11 were fentanyl, but only 1 of those 11 only contained fentanyl. Another one contained fentanyl and another synthetic opioid, 2-methoxyacetylfentanyl. However, 9 of those also contained heroin. 2 were fentanyl and heroin only. 3 also contained ketamine. And of the 3 that contained ketamine, 2 also contained tramadol. So it was a mixture of fentanyl, heroin, ketamine, and tramadol. One of those were acetylfentanyl and gabapentin. One was found in combination with U47700. And here's an instance of an unconfirmed substance found in combination with the fentanyl and heroin. And then of the synthetic opioid identifications, there was 1, and it was found in combination with heroin, and it was 2-furanyl-fentanyl. In the north central region, there were 18 synthetic opioid identifications, and it's a very similar sort of pattern, actually. There were 17 fentanyl identifications, and only 6 of those contained only fentanyl. However, 11 of those were a mixture of fentanyl and heroin, and you can see of those 11 how those were also cut with other controlled substances. So here's where the story starts to look a little bit different. And what I do want to point out is that I chose at random a 2-week period. We do look at synthetic opioid identifications on a biweekly basis, and we monitor those for trends. And so I chose one 2-week period at random. And the data from the other 3 laboratories, as well as this one, was it encompassed exhibits that were analyzed between October 15th, 2017 and October 28th, 2017. So it was chosen completely at random. However, in the Northeast, there were many, many more, not only identifications of synthetic opioids, but combinations. There were 63 fentanyl identifications, of which just less than half of those contained only fentanyl. However, 5 of those were found in combination with tramadol. One of those was also found in combination with acetylfentanyl and one with ketamine. There were 2 that were also identified with 4-ANPP and one with morphorphan. Of the 63 fentanyl identifications, 24 of those were found in combination with heroin. And I'm not going to go through and read all of these, but I do want to point out something particularly interesting to me. One is the combination with tramadol, and it's something that we're seeing in each of our laboratories, and we're seeing that as an increase. Also, the ketamine, cocaine, methamphetamine, also with other synthetic opioids, and in one particular instance with a synthetic cannabinoid. And so these are not trace and residue type samples. These are seized drug powder. There were a much larger number of synthetic opioids identified in this region in this particular 2-week period, and those are listed at the bottom. In the southwestern region, which typically covers the southwestern border of the United States, there were only 5 fentanyl identifications. But when I looked more closely at it, I thought, well, that seemed a little bit unusual, but that's because it represented over 19 kilograms of fentanyl. And it was fentanyl as the only controlled substance. Keeping in mind that what's reported here are other controlled substances or what could be considered a potential controlled substance analog. However, this is likely not 100% pure fentanyl. It would have been adulterated with some sort of sugar or dipyrone or some caffeine, some other non-controlled substance. And then there was one other identification of 4-ANPP, and I believe this was approximately 1 kilogram of material. I did not think that this was probably representative of what is typically analyzed, and so I did, just to be a little bit more transparent, I did take the following bi-weekly reporting period to look at what else was analyzed from this region, and there were 20 synthetic opioid identifications. All of those were fentanyl, and 16 of those were fentanyl only. 3 were with tramadol, and 1 was in combination with heroin. So moving back towards our emerging threat report, the emerging threat report has stayed pretty much consistent for the last 2 years. And we have been monitoring drugs in each of these 4 classes: benzodiazepines, benzofurans, tryptamines, and hallucinogens. And in the tryptamine and hallucinogen categories, which is actually reported in our report, there has been very, very little change, very few new substances that have emerged. And it's something that we decided not to include in our report moving forward, because it's not something that we're seeing a tremendous amount of change or anything new and emerging. However, in the benzodiazepine class, we are seeing many changes and new and emerging substances in this class. And this is not necessarily diverted benzodiazepines, but illicitly or clandestinely manufactured drugs in this class. And we're seeing them increase at a rapid rate, particularly atizolam. There were 43 identifications of atizolam in 2017 alone. We do believe that over the first quarter of next year, there will likely be other benzodiazepines that become identified, because we know that we're working on several reference materials for the identifications of these. That's an upcoming change that you can expect to see in the, starting with the 2018 emerging threat report. We also include an other category, and so these are other substances seized and identified in 2017. There were 53 substances that were unconfirmed, and it's not always lack of an available reference material. However, that could possibly be the case. There was also a 3-methoxy-PCP, mitragynine, which is the drug ingredient in kratom, methoxetamine, deschloroketamine, 4-fluoroamphetamine. But again, these are things that sort of get reported each quarter, but we don't see a whole lot of change in these other categories. The SWIG Drugs website includes several resources that we populate with data that's acquired or generated here in our laboratory. And since SWIG Drugs started posting drug monographs, we've actually authored about 200, I think it's 299. I have one that's pending, which will get us to that 300 mark. And we are making a minor change to monographs, starting with some of these newer ones. And on the last page of the report, we had been putting a hyperlink to external sites. And we had started doing this because at the time we had first been creating the drug monographs, there was very little literature, peer-reviewed, published scientific literature that had structures and names and methods and spectra of these substances. However, now there's many really great publications and work being done. And so we decided not to include these links. The only reference that we will include moving forward is any scientific literature that we use in actually making or structurally elucidating that reference material. And in 2017, we published 41 new monographs, and I've listed them here at the bottom. And many of them you can see are fentanyl-related substances. So many of the new fentanyls that were identified in 2017, we created monographs for, such as the tetrahydrofuran fentanyl or THF fentanyl, also the alpha PPP, which was a new cathinone that was identified. And so this is a way that we're able to provide some of the data from our new reference materials. We've also been doing many more frequent IR instrument library updates. For those of you that are listening that are working in forensic drug chemistry, we're up to version 1.6, and it was last updated in December 3rd, 2017. Although there is a new version coming, we are trying to, as best we can, to publish this on about a monthly basis. Enough that we can provide data more frequently, but not so much that we're having to update instrument libraries too much. It becomes burdensome. However, we have over 340 compounds in this library now. All of the data in the FTIR library comes from reference materials that we actually have in our laboratory. So they are authenticated reference materials from special testing. We had been including in the library mostly emerging drug type compounds. We had been mostly including NPS. However, we've moved away from this and are now adding all classes of materials, both controlled and non-controlled. So it's going to be a much more comprehensive library going forward. Our instruments, we have multiple types of instruments. However, we make the library available in multiple formats: Omnic, Opus, PerkinElmer, JCamp, and then we also keep a running compound list. And so with that, that's the information that I wanted to share with you this afternoon. I want to thank you so much for registering, for attending, and for listening, and for supporting NDEWS. And I would love to answer any questions. There are some.
We did get about 9 questions in, so I think you were going to just read through them, and I'll just remind everyone that if you do have a question that you would like to submit, please do it through the Q&A box. We need to get it by writing. Thank you. And once again, just to remind everybody, in case some of you maybe were a little late, we will be making a complete recording of the webinar and a copy of Ms. Head's slides available on the NDEWS website, www.ndews.org. Just give us a week or two to get everything together. Thanks.
So there's a question. It says, how do we interpret precursors in test results? What if we see NPP listed? Can we conclude fentanyl was involved? That's a good question. So in the analysis of seized drug material, we can't always tell what the precursors were. And so, for example, if it's a fentanyl, if it's fentanyl powder, we'll be able to identify the fentanyl. However, sometimes there may be unreacted precursor material still present in the sample. So for example, if it's fentanyl that was manufactured using 4-ANPP as a precursor, it is possible that there could be 4-ANPP at low levels in that sample. However, if we're looking at this from a clandestine laboratory sort of point of view, if there's NPP or 4-ANP present, plus all of the other chemicals that are needed to manufacture, to synthesize fentanyl, then that leads to the conclusion that fentanyl was involved. The next question is, how do you determine the potency of new fentanyl analogs as compared to morphine? That's not something that is in my area of expertise or something that we do here in our laboratory. There is information that's available on DEA.gov related to testing that's done to determine the potency of new fentanyl analogs, but that is not something that we do here in our lab. Does the DEA have any clue as to the relative potency of the new analogs, such as U49900 or benzoyl benzylfentanyl, for example? Again, that's not something that we test for here. And when we're looking at possibly predicting new structures, this is based completely on theoretical interpretation. What could possibly be added? Now, that's not to say that that drug would have any activity or that it would be something that could be easily made. But that's, I think, part of the danger with these substances is initially a lack of readily available potency information and danger information and hazard information. But again, as they're tested and studied, there's some great literature for that. Is the form factor of samples captured within your program's data? Yes, it absolutely is. And many of the fentanyl samples are also found in tablet form as well as capsule form. And the tablets can be just pressed tablets, fentanyl, and binders and starches and other cutting agents. However, we also see tablets that are that look like counterfeit pharmaceuticals. So they may look like oxycodone, however, instead of containing, or they may look like OxyContin, but instead of containing oxycodone, they would contain fentanyl. Could you please explain the differences between NDEWS data and the forensic chemistry analysis data? Absolutely. So NDEWS data is much more representative of all drug samples that are analyzed in laboratories in the United States. So NDEWS contains state and local laboratory seized drug analysis information, so state and local laboratories. It also contains the DEA laboratory data and other federal laboratories. So NIFLS data is compiled by registered laboratories that agree to send data to NIFLS. Our data is strictly related to DEA seized drugs that are analyzed only in our laboratory system. And new synthetic cannabinoids are still being sold in packages. Not necessarily K2 and spice. I'm sorry, this was the second question. Are new synthetic cannabinoids still being sold with names such as K2 or spice? And although K2 and spice, those were brands that were included on the label of packages when synthetic cannabinoids emerged in the U.S. and in Europe in 2009, 2010, in that sort of time frame. That is used as a common phrase for referring to them, although as a brand, I haven't seen K2 or spice in some time. But we are still seeing a lot of synthetic cannabinoids still seized and submitted to our laboratories in branded or packages with labels and barcodes, that sort of packaging. I saw there were some seizures of 5-methoxy-DMT. Do you know if these were synthetic or extracted from the Colorado River toad? It's hard to say. I believe that these were powdered samples, and I would suspect that they would be synthetically manufactured. Are you able to speak to the risks and/or benefits of kratom to human health? Again, that's what we're looking at in this lab is how to identify substances, how to identify plants, how to quantitate those results, but we do not study physical or biological effects of drugs on human health. For the substances unconfirmed, were you able to determine if they were psychoactive or inert? Sometimes when we look at data for substances that are unconfirmed, sometimes it is something like a pesticide or some other material that is a powder and not necessarily drug related. However, most of them end up being some sort of drug in a drug class that we're familiar with. Whether or not they're psychoactive, we don't do testing here to determine whether or not they're psychoactive. We just try to elucidate the structure to identify what that substance is. It says, how many synthetic opioid identifications total were there in 2017 to create the 117% increase in 2016? The answer to that question, there were 2,825 identifications of synthetic opioids in 2017. DEA has recently emergency scheduled all fentanyl compounds. Do you predict the new opioids based on non-fentanyl structural templates will now be appearing? That's a really interesting question, and it's something that we're certainly looking at. When SDAPA, or Synthetic Drug Abuse and Prevention Act, was approved in, I believe it was 2011 or 2012, that was an act that did some structural class-based control, and we saw a change from a particular core structure to a new core structure. Instead of it being an indole, we saw benzimidazoles. So it'll be very interesting to see what happens with the control with this control act, which was effective February 1st of this year. And so that's certainly something that we need to keep an eye on. Also, there's been some international control for ANPP and NPP, which are the two primary fentanyl precursors. And so all of these things will be very interesting. It will be very interesting to see what happens to these to the new opioids. Based on the emerging patterns in 2017, what is your outlook for 2018 overdose deaths in the U.S.? Regarding overdose deaths, there's a lot of outside of reporting and monitoring. There's a lot of efforts in our community, in the NDEWS community, in trying to provide help and assist in these areas. It is alarming to me that we continue to see such rapid change in this class, and it's a class of drugs that are causing so many fatal overdoses. So I'm hoping that we see some really great progress throughout 2018. But I think that between the international controls and the placement of several fentanyl-related substances in Schedule 1 and some class scheduling action, that we see some positive changes in 2008. Regarding mixtures, what's the minimum concentration for a substance to show up in your data? I'm asking to understand if it might include traces. So in general, in forensic drug analysis, if it is present, we are typically able to identify it. And so many of these are not traced. However, there is variation in how pure each substance is in that mixture. In general, fentanyl purities range from are approximately 6%, and that's a very loose average. We've seen anywhere from trace level up to over 95% pure fentanyl. So there is a wide range there. It is likely some of these may be traces, but the vast majority of these are larger seizures, and they also most of them are not traced. Is there any program or way for developing countries to acquire reference standards for NPS? Absolutely, and that's something that our program is able to assist with. There are many reference materials commercial providers that will ship internationally, and we can help answer those kinds of questions. Where our program is also able to provide small quantities of reference materials to countries that have difficulty in importing or lack of available providers within the country, but that would require some working through DEA's foreign country offices. But my contact information is at the end of this presentation. You can reach out to me and I can answer some of those questions offline. Have any clandestine labs been seized for NPS? Very good question. We are, there have always been some clandestine laboratories in the US. There have been some very small scale fentanyl clandestine laboratories in the US. However, this is not, the fentanyl that we are seeing now in this country is not being domestically made. It's not clandestine laboratories here in the US. For the cathinones and cannabinoids, those also, there have, as far as I am aware, there haven't been any domestic clandestine laboratories here in the US. What we do have here in the US, though, is processing sites or processing labs where there will be an operation that is milling fentanyl, mixing fentanyl with other substances, or tableting operations or tableting labs where synthetic opioids or fentanyl is being pressed into tablets. Also processing laboratories where powdered synthetic cannabinoids are dosed onto plant material and then packaged prior to being sold. I think we are getting kind of towards the end here. I'm going to try to answer a couple more questions. Is there a list of street names that can be matched up with the chemical names somewhere? So naming is actually something that's really interesting for us, because a lot of these drugs are they're not published in scientific literature, or there isn't a name for them, and so we try to strike a balance between using the really long formal chemical names, which can be 24 to 40 characters long, and even for a scientist, that's something that's really hard to recall and remember easily. And so these names are names that these are the common names, or the more simple or common name of the substances. What are the benefits of combining multiple analogs plus fentanyl plus heroin sometimes? Why do this? That's a good question, and it's not something that I have a concrete answer for. Money always plays a role in drug sale and trafficking, and we do see much more polydrug trafficking and seizures the last several years. Why don't you expect novel tryptamines and hallucinogens to be coming in future years? It's not that I don't expect them to be coming in future years, it's that we've been tracking them now for 2 to 3 years, and it's remained very, very constant over that time. And it's just not something that we see a lot of in the DEA laboratory system. It's not something, we're definitely not going to stop monitoring it. We'll continue to look, but it's something that has remained fairly consistent without a lot of new drugs in these classes emerging. That being said, there are some LSD type substances that we're keeping an eye out for that we are concerned about seeing in the next couple of years. Do you still see the newer synthetic cannabinoids in combination with one another? Absolutely. And I chose to do the synthetic opioids only because it's something that we had been recently discussing with the NDEWS Scientific Advisory Group. And so I chose to focus on that. However, we do definitely still see synthetic cannabinoids in combination with one another, either anywhere from 1 synthetic cannabinoid dose on the plant material to 3, 4, 5, and even 6 synthetic cannabinoids on the same plant material. Are you finding any synthetic cannabinoids in CBD oil in your seized items? This is a follow-up to the Utah outbreak reported over the NDEWS listserv next week. We have not. We have not seen any, to my knowledge, I don't recall seeing any synthetic cannabinoids in CBD oil in anything that we analyzed in 2017. What is the significance of the small number of 4-ANPP listed in the seizure data? Is this precursor chemical, like assume the kilo in Southwest, or impurities in the fentanyl itself? So I think what you're alluding to is correct, that the 4-ANPP is significant because that is a precursor. And it's important for us to be able to track and monitor fentanyl precursor chemicals. How is a fentanyl type substance accounted for if there is no panel or reference for it? Would it over or understate statistical data? So of the substances that were reported in 2017 and in all of our data, there is always a reference material for it. Our procedures do not allow for us to identify something without a reference material. And so this is where we would see something like substance unconfirmed, that there's no reference material for it. In seized drug analysis, we don't have a panel like what you would use in, like what would be used in forensic toxicology. We use a parent drug material or a parent drug reference material. So So if there were no standard, then we would be under-reporting. For the FTIR database, are you considering fentanyl and heroin blended samples? We do not include mixtures in the library. And the reason for that is all of the entries in the FTIR library are of authenticated reference spectra. However, in your own laboratory, if you work for a drug laboratory, reference materials could be blended in known combinations to show varying the varying response or change in response at certain concentrations, and that's a way to help you in interpreting spectra. However, our database is for just clean reference material spectra. Okay, so I know that there are still many more questions, and I hope to be able to answer those offline. I believe that those can be sent to me. Is that correct?
Thank you so much, Jill. We really appreciate your presentation. That was an incredible wealth of information, and it was great to see all that data pulled together and presented that way, make it so easy for all of us to understand and follow the story. And I appreciate also all the questions that everyone submitted, and we will work with Jill to get back to some of you offline whose questions we perhaps didn't get to, but you can also submit your questions to ndews@umd.edu if you're interested in additional information, and we can get back to you that way as well. Or you can join the discussion on the network, as I mentioned earlier. We'd be happy to see you there. And just one more reminder, yes, we will make a full recording of this webinar available on the website, www.ndews.org, along with a copy of Jill's slides, so you should be able to find your information there. Give us 1 to 2 weeks to get everything put together and posted up on the website, and I'll post an announcement to the network when it's available. And I would just like to get you guys who are left with us to please do a quick poll for us, and so we can get some information on what other kinds of topics you would be interested in hearing about. And while you're doing that, I will let you know about our upcoming webinar, which will be on March the 14th, again at 2 p.m. Eastern. This one will feature 2 presenters, Dr. Mance Buttram from Nova Southeastern down in Florida, and Dr. Jennifer Havens from the University of Kentucky College of Medicine, and they will be talking about what they've been learning through their research about the misuse of gabapentin, which is a prescription drug that's traditionally used to treat seizure disorders like epilepsy and also nerve pain. So I hope that you will be interested in that topic, and that we will see you again then. And I will post an announcement when we get closer to that date so that you can register for that webinar. And we have some other interesting topics coming up as well. So please keep an eye on the NDEWS network for that information. And it looks like a lot of you have gone ahead and answered our 3 short poll questions. So thank you for that. I'll give you a little bit longer in case there are any more of you who would like to do that. And we will use that information to prepare our upcoming webinars. All right, so it looks like things have slowed down a little bit. So thanks again to all of you for joining us, and thank you again, Jill, for all the effort that you and your team put into preparing all the information for us today, and for going through all of the questions that were submitted by our viewers. And hope to see you all next time.